I was diagnosed with esophageal cancer in April of 2009. And he told me his diagnosis. Immediately I was like, oh, not again, because I'm a breast cancer survivor of 12 years.
And then the CAT scan actually showed the pancreatic cancer. And so, of course, it was quite devastating to hear that.
While it was shocking having the diagnosis, we thought that it would be okay in the end. But during the surgery, I found that there were tumors in my liver.
I called the wife and told her we better make an appointment for something.
The real benefit for a patient in coming to a comprehensive cancer center is that all of the specialists required to individualize that patient's therapy, to give that patient the best chance of a positive outcome, are come together in the treatment of each patient that we see. We have specialists in pancreatic cancer, both in the surgical approaches, the radiation oncology treatments, and the medical oncology or chemotherapy treatments. And it's their ability to coordinate the care for that patient that gives the patient the best chance of being cured.
The team at the Abramson Center is huge. There's one that you see and you interact with, and there's a team that's behind the scenes. For instance, there are radiologists, there are pathologists whom I've never met, but I know that they were involved in my treatment and involved in the decisions that were being made, and I think that that was just perfect.
We know that the best therapies are combined modality therapy when talking about gastrointestinal malignancies, but it takes your physicians to figure out what is the optimal order of these therapies to be placed so that you get the best outcomes down the road. Not all the time is it surgery first. Sometimes it is, sometimes it isn't. Other times we'll use radiation and chemotherapy to shrink a tumor down so that you may get a better surgery down the road.
That's why I like the comprehensive approach at the Abramson Cancer Center, because everyone is in dialogue with one another constantly.
We are very involved in clinical trials here at Penn Medicine and at the Abramson Cancer Center. That's the way we think we can improve therapy both now and in the future for patients with these diseases, and improve not only their overall survival and their surgical outcomes, but also their quality of life.
I thought I'd be foolish not to go and take an opportunity to be in a clinical trial. It may have made the difference of my life.
A clinical trial can offer the patient very unique opportunities. It can offer them treatments that may not be available otherwise. It can offer them opportunities to be overseen by a whole group of people. So it's an even bigger team that's taking care of you in regards to nursing and people overseeing the trial.
With the recent opening of the Roberts Proton Therapy Facility, we now have the capacity to deliver treatment modalities in a multidisciplinary form using proton therapy, which is an exciting and, we hope, much more effective and less toxic way to give radiation therapy.
The Integrative Oncology and Wellness Program seeks to help to support patient survivors and families to deal with the experience of cancer and finding strategies to live healthy and to restore a sense of vitality and resilience.
Treating GI cancers is for me, a passion. I find that patients need a whole litany of care, from radiation therapy, which I specifically do. There's medical oncology, there's surgical oncology, but more specifically, I get very involved in the nutritional care and the supportive care that needs to happen with the patient through treatment. It's not one person, it's not just the patient. It's really everyone pulled together to give you the best care possible, and that includes your friends and family too. And that's just as important as everything that we deliver here.
My partner was with me the whole way. And every step of the way, I had family that came from Wisconsin, from Massachusetts, from California, spent time with me. Friends were always there. I couldn't have had a better support system between my home and between the hospital. And the Abramson Cancer Center, it made a complete package for me.
Everyone was so kind and understanding with my treatment and did everything possible to make me feel comfortable. And that was the sentiment throughout my whole recovery and being at the hospital. What can we do to make you comfortable? How can we help you? How can we help you through this, for this to be a positive experience for you?
I had nutritionists that came and spoke with me. I had even people that came and spoke with me about if I wanted acupuncture, if I wanted any kind of other, alternative treatments, anything to help me feel better. It made a bad experience be a good experience for me. I mean, it did save my life.
You got responses, you got answers to your questions. There was no beating around the bush with you. I like things direct, so they would tell me direct. I just think back on how fortunate I was to have the nurses, the doctors. I wouldn't recommend any place else for anyone else to go to.
For years, it was always one step forward and 3 steps back. But I just kept moving forward because eventually I just was moving forward. I'm probably more healthy than I was before I had cancer. And I look like myself, finally.
I've been back to work for a year, just got a promotion to associate director, and my life it couldn't be better.
I'm a teacher, so I've been off of work almost a year. I plan to retire in June, and also once I heal, I want to give back. So I plan to go to Abramson Cancer Center, volunteer, be of service, and that's what I want to do.
I'm fortunate. I'm out in the golf course, still cursing the golf ball.
And she's going to be 60 years old on Tuesday. We never thought we were going to see that. 60 years younger.
Hey, you said give me a hug.
There we go. Couldn't hear him. You did.